Hey, welcome back to the channel. Today we're going to be talking about a possible solution for shoulder pain that you might be experiencing. Specifically, shoulder pain that you feel in the deltoid region when you lift something out by your side. So if you think about the exercise you might do in the gym called a lateral raise, where you have a dumbbell in your hand and the idea is to just raise your arm out by your side. Or it could be pain that you feel when you're going through your daily tasks and you just reach out and grab something, lift it up, and you feel that pain in the deltoid area. Today I'm going to teach you an exercise called an axillary nerve glide. And what it is a mobilization for the axillary nerve, which happens to supply the deltoid muscle and a small portion of the skin around the shoulder region. Now here's what I've learned over the last couple years, because I've shared this exercise on Instagram, and for several years in a row, it has been our most viewed content. And I've received direct messages from people all over the world, very commonly saying, hey, thank you so much for sharing that exercise. It has solved my chronic shoulder pain that I've had for 10 years. This is something that I hear all the time from people. So I want to teach it to you. It is an amazing exercise. It is very high payoff for a lot of people. Are you ready? Here we go. Okay, so before we do the exercise, it's really important that you have an assessment on hand so that you can measure your body's response to the drill, because we want to make sure that the drill is the appropriate one for you. So really simply, if you're having that kind of shoulder issue, lifting your arm out to the side, then that really should be our assessment. As long as making that motion is not going to exacerbate your pain issue, then it's safe to use it as part of your assessment. So you can just move your arm out to your side, take a qualitative assessment. How easy or difficult is it, and what does it feel like? Do you have discomfort? Are you running into pain? How far are you going? All of those things. And if you want to take that assessment one step further, if you're safe to do so, you can actually lift a weight out by your side. And again, kind of take a qualitative assessment of how easy or difficult lifting that weight is and what does it feel like. Once you get your baseline assessment, now you're ready to do the drill. All right, so we're going to be creating a position with our body that's going to put the axillary nerve under gentle tension, and then I'm going to show you how to move in a specific way that then mobilizes the nerve. So it's a sequence in terms of the positions. We got to put all those pieces together and be really, really precise when we do it. So here's what it looks like. I want you to partially bend your elbow, and then I want you to inwardly rotate your arm. It doesn't have to be forced. There really shouldn't be any effort. You're just kind of letting your arm fall in to internal rotation. From here, you're going to move your arm behind you, and then you're going to take your whole shoulder complex, meaning your shoulder joint and your shoulder blade, and you're going to depress it down towards the floor. And that's an active movement coming from your muscles to pull your shoulder blade down. Okay, so now we have kind of a combination of positions put together for the sequence in terms of what we're doing with the arm. So at this point, what you're going to do is take your head and your neck and you're going to tilt away. Now, immediately when I tilt my head away from my shoulder, my sense of neural tension increases. And what I mean by that is I'm starting to feel a stretch, but it's a little bit different than, say, feeling a stretch on a muscle, because this is more of a radiating stretch that kind of covers a broad area. And so for me, I'm feeling the stretch sensation coming down the shoulder area, particularly right here in the front, and that's good. Now here's the part that I need you to pay really close attention to. When you get yourself into the position where you're starting to feel the stretch sensation, it is critical that you keep it gentle. A 3 out of 10 in intensity is what I tell everybody. The reason I say 3 is because I know you're not going to listen to me and you're going to do a 5 or a 6, but I want you to just be super gentle. 3 out of 10 intensity, because nerves don't like to be aggressively stretched. So we need to be careful about how much tension we actually put on the nerve. Okay, so here we are. I'm feeling the sensation now. And what we're going to do is, while we're in this position, we're now going to drive the mobilization, that's what we call it, using a driver, and we're simply going to be moving, in this case, coming from the shoulder joint. And what I'm doing is creating circles coming from the shoulder joint. Now, as I do this, I'm really thinking about moving with high quality, nice and slow, creating a smooth circle, and making sure that I don't lose any pieces of the sequence. Often what happens is because it's challenging from a coordination standpoint to hold all the positions and then make the movement, people start to lose some of the other positions like the elbow flexion or the internal rotation or the head tilt. And so you just want to make sure that you stay in the position while you're performing nice, precise circles coming from the shoulder joint. Okay, so after that, call it maybe 8 circles or something, maybe 5 in each direction. You can shake it out, okay? And this is now the time where you want to retest. So test that motion, right, with your arm. If you were grabbing a weight and lifting it, this is when you want to do that again, and you want to immediately get an idea of how your body is responding. Now, many of you are going to be mind blown at this point because, and I just know from experience, having seen this work on so many people and having got those messages from folks, that something that seems so simple can have such an impact on deltoid function. So if you get a good result from this and you notice that the motion's easier, maybe you're able to move further, maybe you're able to lift that weight without pain, that means this is a high payoff drill for you. All right, so now let's get into a few important details. I showed you the general position that is used for the axillary nerve glide, but with nerve glides, it's really important to understand what kind of little adjustments you can make to help the exercise fit your body best, because each individual carries a different level of neural tension, and they're gonna feel this very differently. So sometimes we need to adjust the position a little bit to get the most out of it, and I just want to share with you a few things that I encourage you to explore to see if you can get an even better result. So here we are into the position. Let me go through it again. Partially bend the elbow, rotate the arm in, move the arm back, depress the scapula, that's your shoulder blade, and then from here tilt your head away. Now, many people will feel appropriate tension in this position, and if that's the case, you're good to go with your shoulder circles, being the driver. But sometimes we got to do a few things differently. So the first thing you can explore, I'm going to show you a different angle, is that some people do better when they move their arm further back. Okay, so by moving your arm further back, it may increase tension on the axillary nerve. So that's one idea, and you can try that. As long as your neural tension doesn't go way up beyond that 3 out of 10, then you can try that. If you move your arm back and all of a sudden you're at an 8 out of 10, then we're not going to do that because that's too much tension, okay? So that's one idea. The other idea is some people do really well when they take their arm, it's already moved back, and they adduct it, meaning they move their arm towards their spine. Now, for me personally, as soon as I adduct my arm, I lose tension on the nerve, and I'm no longer targeting the axillary nerve as well. So this is, again, very based on the individual. So you can try moving the arm slightly back towards the spine, and if you feel an appropriate increase in tension, then that would be a good position for you to try, okay? And again, now you would drive from that position, okay? Last one is the head and the neck. So for me, right about here is good, and as I tilt away, now I've got my 3 out of 10. One thing you can explore is rotating your head and neck, in this case, away from the target shoulder. Now, when I do that, my neural tension increases a little bit, so it puts additional tension on the nerve. I still feel like I'm in that 3 out of 10 intensity zone, so I'm good. And rotating away actually has improved the sensation that I'm feeling. And so this is actually ideal for me. And now, and I'll show you from the side, now I'm going to make those precise shoulder circles, making sure that I don't lose depression of my scapula. That's really common, is people start kind of losing that and then tension comes off the nerve. So this is actually feeling really good. I can do this in both directions. And then when I'm done, shake it out and do my retesting. All right, there it is, the axillary nerve glide. Hopefully this drill is really useful for you. I don't think I said it in the beginning. It probably is obvious, but you want to be testing this on the shoulder that is causing you the discomfort. If you happen to have discomfort in both shoulders, then try this on both sides. But remember, always assess it, because everybody responds differently to exercise. And that's why it's just hypercritical to go through that quick little assessment process so that you can understand how your brain and your body is perceiving what you're doing. And as I said, if you get a good result, we call that a high payoff drill. That goes into our high payoff toolbox so that we can use it accordingly. So let's say you discover that this exercise is high payoff for you. The first question that I always get is, how often should I do it? And in a typical scenario of using this for pain relief or kind of a potentiation type drill to improve movement of the shoulder, maybe before you do something else, like if you're working out, typically what I tell people to do is, for pain reduction, you can do this maybe twice a day, and usually about 5, maybe 10 repetitions at a time. So think like 5 in each direction or 10 in each direction with those shoulder circles. As long as you keep the tension really gentle, 3 out of 10 in intensity, that should be a really good starting place. But you don't want to go and do this 5, 6, 7, 8 times a day, because eventually your nervous system is going to get ticked off at you because you keep putting more and more tension or stretch on a nerve. And remember what I told you, nerves don't like to be aggressively stretched, but by gently tensioning them and then mobilizing the nerve, you can create some pretty profound results in terms of mobility and pain relief. So that's all I had planned for you today. Please let me know if you have any questions. I'd love to hear from you and help you out. You can ask those questions in the comments below. If you haven't already done so, please subscribe to the channel. If you like this video, give it the old thumbs up, because that really helps. And thank you for watching. I'll see you in the next video.